Hey everybody, it's Ryan, and this is my blog number 5 on the reading and writing marathon. I walked around campus and listened to the podcast about healthcare and the institutionalized racism in healthcare. It's episode 4 on the New York Times, and it's hosted by Nicole Hannah-Jones. So this first spot that I was at the library, Nicole was talking about her personal experience with institutionalized racism, about how the tragedy of her uncle passing away because he was unable to receive health care when he was terminally ill, or rather, he wasn't terminally ill, and by the time that he was terminally ill, he was finally available to get health care, but it was too late. And then at my next spot, Nicole was talking about the very first laws enacted that freed slaves, but they weren't really free because they had no possessions, they had no home, they had nowhere to stay, so they were getting a lot of diseases. They weren't able to practice proper hygiene at all, and nor were they able to get health care, so there was just a really mass killing of slaves who were free but not free at all. They didn't have access to anything that majority races had. And then at my third spot by the creek, I was listening to Nicole talking about how a narrative started about black people dying. Some white people in court and in law were saying that it's just nature taking its course, and it became so normalized that it almost became a law. And then in my fourth spot, in front of Butte Hall, years later, the separate but equal clauses were written into law, where black patients had to go to their own black facilities, which were few and far between in a lot of places, or they were relegated to the basement wards of white hospitals, which were much less cleanly and practical than other white facilities. And lastly, I sat in front of my hall and did some listening, and this is when Nicole's talking about how Lyndon B. Johnson proposed Medicare, which is supposed to be the rebirth of Truman's failed national health insurance program, but it also doesn't work out too great, and they still see a lot of racism in the healthcare system. And that's all.